I'm going to talk about osteoarthritis. Osteoarthritis is a chronic inflammatory condition involving the joints. It majorly affects the big joint, especially the knees, the hip, lumbosacral joints, lower cervical joints, and it can also affect the small joints of the extremities. It is characterized by inflammation of the joint, and it affects the synovial membrane which surround the synovial joints. Synovial joints are those joints that are involved with the movement. So there is a movement of the joint, and so the synovial membrane is the one that starts to get inflammation, and due to the inflammation of the joint, the synovial membrane is destroyed, and the destruction could be continuous until it reaches a level that the two bones that are joined together get to come into contact with each other. So the main symptoms of osteoarthritis, as I said, there is pain. The pain is usually worse with joint movement. There is limitation in the movement of the joint. There is a swelling of the joint. Sometimes you can have joint deformity, and you can also have complete destruction of the joint, leading to stiffness and inability to use the joint. Usually, the main risk factors for getting osteoarthritis include age, obesity, because the more bigger our body size, the more pressure we put on our joints, and this leads to progressive destruction of the joint. Then we have previous injuries to the joints. This can be traumatic from various causes, being involved in an accident, which causes risk to the joint. Then you can have infections to the joint, and then you also have genetic factors. So there are people, because of their genetic composition, they are predisposed to osteoarthritis. So how do we make a diagnosis of osteoarthritis? Majorly, the main diagnosis is made through the history of how the patients present, the joints involved, and also examination of the joint. If there is not very clear symptoms, or there is doubt whether it is osteoarthritis, then a plain X-ray can be done of the joint. And through the X-ray, you are looking for the loss of the joint space, looking for the development of osteophytes, which are bone outgrowths that, because of the bone trying to restructure itself, you have development of excessive bone growth, which leads to osteophytes on the bone edges. Then you also have subchondral sclerosis, and you can also have subchondral cysts from the joint destruction. To rule out the possibility of other forms of arthritis, you can also do a rheumatoid factor to rule out rheumatoid arthritis, and you also can do anti-CCP test to rule out rheumatoid arthritis. So treatment for osteoarthritis is majorly pharmacological, and also surgery. The non-pharmacological steps that can be taken include losing weight for those who have obesity, exercises to increase the joint strength and also help build the muscles around the joint. We also have dietary measures to try to avoid things that can increase the chances of joint destruction. So good nutritional uptake, and in ensuring that you have good supply of carbohydrates, proteins, and avoiding excessive fats, which could lead to excessive weight and excessive pressure on the joints. Then for those who have osteoarthritis have started, then medication can be used to help relieve the pain. Usually you start with a simple analgesics like paracetamol. Then if paracetamol is not adequate, you can use non-steroidal anti-inflammatory drugs, and sometimes if the pain is too much, you can go to opioids. When you can also have intra-articular injection of steroids into joints that are involved, especially the knee joints, but this one, the results are not. There are various studies that have shown contradictory response. Then if the medications do not fail and the pain is still very persistent, then there is a big role for surgery, where you can have total replacement of the joints to help the individuals get into their normality through the replacement of the joint. So that is what it is on osteoarthritis. It is a chronic inflammatory disease, mainly affecting the big joints, especially the knee, the hip, the lumbosacral joints, the lower cervical joints, and joints of the extremities. It can be prevented through maintaining good body weight, getting attention when you have joint injuries, and also exercises can help to maintain good joint health. Thank you.